one. And want to thank everyone for joining us today for our Access to Care Subcommittee. My name is Kim Schlessinger. I am co-chair along with Emily Cronin. And today we don't have a lot on our agenda, but I just would like just to remind everyone that we really value everyone's input and feedback. The opinions stated during the meeting are from the provider's perspective, but we really value everyone's giving us their input as we embark on this fact-finding mission. The scope statement and objectives of this subcommittee are posted on the MLAC webpage. You can find the updated scope statement and objectives under the 7/11/25 meeting. And so I think we'll go ahead and get started. We have Audrey Duke, a nurse practitioner, to give us some of her input and feedback on access to care. So let's see, Audrey, I see you there. I'm going to go ahead and hand it over to you. Oh, Audrey, I think you need to take yourself off mute.
Keeps pushing it. We had it working a little earlier, but it looks like she's having issues with the mute button.
Good morning, everybody.
There you are.
Morning.
Yay, good morning.
Well, I'm a nurse practitioner, but I retired 2 years ago. I worked at North Bend Medical Center in Coos Bay, Oregon, and I did workers' compensation from 2006 to 2023. So 17 years with workers' comp. 70% of my practice was workers' compensation. When I started, it was pretty much all workers' comp, and then I did add some other primary care and urgent care stuff. So you were wondering about barriers to care that I experienced when I was a practitioner. And I had a really excellent team. When I came into the workers' comp, it was with Dr. Gerber, and he'd been doing workers' comp for a number of years. We had a person who was dedicated to our billing, and that was really, I think that was key to getting the billing done efficiently and getting it done timely. But I have to say that whoever you have working in your office is really key in keeping the claims moving along. And I had a medical assistant with me for a large number of years, almost like 15 years of my practice. And she was excellent she knew the paperwork inside and out. And I think that is really key in having it work efficiently. Now, after COVID, I think a big barrier was access to getting people treated, as far as referring them into physical therapy, and wherever you wanted to refer them, it was just more difficult. And I am relatively certain that is a barrier, a big, huge barrier still, because it is in primary care as well. Getting people in, you need to get them treated in a timely manner. I was lucky at North Bend Medical Center when my medical assistant would put in a referral for an MRI or whatever. We got it done pretty quickly. But I think that's probably another barrier since COVID as well to getting things done quickly. Um, we didn't have any trouble with billing at North Bend Medical Center as far as we'd get our MRIs done at North Bend Medical Center. And I didn't have to get pre-authorization or anything like that. So that helped move things along. And quite often, I mean, it just helps streamline it if we were able to get things sorted out as quickly as possible. Rarely was it the injured worker that was the barrier, but I did have experiences with people that really worked the system. And that, to me, I think that was a much smaller population than what I just had that happen rarely, but it did happen, undoubtedly. So, I have a list of questions here. Did I meet with other providers to discuss workers' compensation issues? And I did when I had Dr. Gerber to work with, but when he moved on to other endeavors, then I would talk to the specialists, the orthopedics, and they were always really helpful. It's always nice to have somebody key that you can go to. And I did have several orthopedists here. My background was when I got out of school as a nurse practitioner. I had had many years of nursing prior to going into NP school. And when I got out, I had been working in surgery. So I worked with orthopods for 6 years before I went into working with the workers' comp specifically, which it was like I had a 6-year internship with ortho before. And as you guys probably all know, it's 90% orthopedics. It's a huge workers' comp stuff is huge percentage orthopedic stuff. So that was really helpful to have that background going into being a provider. So, and then I had all those providers that I had worked with that I could call up and say, hey, what do you think? What should I do? What do you guys recommend? And that is always so key to treatment as well. And it says, do you have staff? Did I have staff in my office? The staff in your office is really key in getting things moved along. And getting those people educated and knowing how to do all those things, I think is key as well. So, yeah. When I had issues with workers' compensation claims, I often, I would call and talk to their caseworkers, but sometimes that was a barrier to try to get a hold of the caseworker. So, but being able to talk to the caseworker that is kind of guiding the worker through the process was, I did that often too. So, and since I'm happily retired for 2 years, I don't think I'm going to be coming back to working. Sorry, but so do you guys have any questions for me other than these?
Audrey, I have a quick question. The caseworker, so was that you mean like from the insurance company?
Yes. Yeah, from safe or because generally the claims would start in safe and then, if it was a long-term claim would move into Majoris.
Okay. Thank you.
Co-chair, the other co-chair has her hand up.
Oh, thank you. Sorry, I missed that. Emily?
No, that's okay. I put my hand up because I saw you were going to come off mute, and so I was going to let you go. I do actually have two questions. First, I want to explore a little bit more about difficulties with referrals. I just want to kind of better understand, and I know that COVID, right during that time, definitely had some additional barriers. around necessity of services and sort of limiting staff. But when you talk about referrals being difficult, is it just that like it was scheduling far out for MRIs, or that you were having difficulty even connecting with those referral places, those specialists, to try and even get people on panels or scheduled?
Yes, well, some people just don't even do workers' comp. Some providers, some physical therapy people just don't do workers' comp. And that's a problem. And I don't understand why, because I always thought it was pretty well compensated and in a timely manner. So, but that is a problem, limitations. Like we didn't have, our physical therapy people, we had limited referral places here because we're 2 hours from Eugene. So if you can't get anybody in the Coos Bay North Bend area, our nearest referral place was Eugene, and that's a 2 hour drive for people, and that's just not doable for a lot of people. So that that is a problem.
Okay. Thank you. That's very helpful. And that is specifically within the MCO, right? That we're talking about as far as the available providers and delays for things like MRI and PT. Okay.
Yes.
Thank you. That's very helpful. And then I did have another question, and I lost it. I had to look at my notes. When we're talking about difficulty getting in touch with a caseworker, claims adjuster, once
Mhm.
you start the claim, or start the process, what did that look like? Was it just trying to make phone calls and just not getting a response, or emails, or what is the pathway in your experience to communicating with those caseworkers?
I would usually call them,
Okay.
and if they weren't in, they may get back to me in a day or two or a week. Or I might have to spend more time trying to get them to connect with them.
Okay.
But I generally called because I felt like I got better communication that way.
Sure. Okay. Thank you so much.
It looks like Ryan has his hand up.
Thank you, Kim. I appreciate it.
Hi,
Hi,
Ryan.
Audrey.
Hi, Ryan.
My name is Ryan Hearn. I work actually for Roseburg Forest Products as our workers' compensation manager. We have worked together many, many times.
Yes.
Happy to see you. Congratulations on retirement, all that. Thank you so
Thank
much
you.
for being here. I know you're a wealth of knowledge when it comes to workers' comp and just our experience together. So I appreciate that. Just kind of curious, just wanted to throw this out. If you could identify, you spoke about talking to other providers in the workers' comp system. What do you think, or what do you identify as the biggest barrier for providers getting into workers' comp, if that makes sense? What do you hear around the water cooler, basically?
I think a lot of it, and Ryan, I have to say Roseburg Forest was so good about getting people back doing whatever they could. Some companies did not put people back to work, which made it more difficult because the longer they're off, the more they're off. But anyway, so I appreciate that with you. I think a lot of it is education, and I think that there's people who want to do it but maybe don't have quite the background, and trying to connect with orthopedics and connect with people more, and they don't have those connections yet. But I felt like I was really lucky in my background when I came into this to be able to have those connections. I think that there is a lot of educational stuff that's lacking because we just don't have, it's like you go to conferences and you rarely see workers' comp things on the agenda. I did go to a primary care thing a few years ago, and they did have some workers' comp things on it, but it was more specific for Washington workers' comp, which is different.
It really is. No, I think that's really insightful. It sounds like it's maybe a little intimidating to dip your toe into workers' compensation if you don't know, what the rules and regulations are, or what's expected of you as a provider. So
Yeah,
that's really insightful. I appreciate that response. Thank you, Audrey.
you're welcome. Good to see you.
You too.
Looking here for any other hands, but Audrey, I that's a really good point about the educational. I was also a nurse practitioner working with injured workers, and there was not a lot of educational opportunities for workers' comp in Oregon. And it seemed like you had to go like to these national conferences, which, you
Yeah.
know, a lot of times are, you know, expensive, and the employer doesn't, you know, pay for that for you to go. And yeah, so it is really just kind of, you know, learning as you go.
Learning in the trenches, Kim.
Yes, it's so true. Yeah. And here, if there's any, am I missing any? Oh, Ryan, is your hand up
Yeah, I'm
again?
back up. You know, I'm just kind of curious, Audrey, on, gosh, I had it and now I lost it. Oh yes, if you could change one aspect of the workers' comp system, so the rules or regulations placed on a provider that you think would really open up the system, could you pinpoint anything like that, that you might be able to identify that really burdened you as a provider, I guess, when practicing workers' comp?
Well, what was really helpful in our area was they allowed me to see people longer than, I think it was 6 months, was our time period that we could see people.
180
And
days. Yeah.
since we had a lack of providers here, I talked to a majorist physician in conjunction with seeing people longer. So the more, especially in rural areas where there aren't providers, if that could be allowed, I don't know if you guys, do you guys all understand that aspect of it? It was really helpful. Um, I talked to Linda she's in Central Oregon, and she was a majorist physician that I conferred with a lot on cases that went longer than 6 months, and they allowed me to see those people longer. That was really helpful in a rural area.
So just to clarify that, Audrey, you would have to get like a special permission from the MCO for you to treat longer than the regulatory 180 days.
Yes. Yeah, and it worked out really well, I think.
So, sorry, I go ahead. Sorry, I didn't raise my hand. Sorry, Emily. I'll
No,
wait my
you're
turn.
fine. I just want to ask a follow-up question quickly. It's hopefully on the same line of thought, but I just kind of wanted to hear what the process is like to connect with an MCO and ask for special dispensation on attending privileges, like to extend treatment for more than the 180 days. What is that process like?
Well, it just Majoris asked, they kind of were like, would I be interested? Would I be okay with doing that? As I remember, it's been a number of years since we did that, but they just allowed that. So it worked out well. And then Linda and I would have scheduled, like an appointment scheduled time when we would discuss different cases.
Okay, can we have, Lon Holstein with his hand up, Matt West in the room, and Ryan has a question too. So I'll keep you on track, okay, Kim?
Thank you. I know
Okay.
it's hard for me to see the hands, but okay, so should we go to Lon first and then back to Ryan?
There was the discussion and testimony regarding staff and the training of staff. How many people did you have as staff, and what were their roles that made it easier for you to be able to treat injured workers?
I had a medical assistant that she just, again, learned on the job workers' comp things. She was a very good medical assistant. She had her degree, and She was just exceptional. And then we had somebody at North Bend Medical Center in the billing department that specifically did all our workers' comp billing. And she'd been there for a long, long time. She again was somebody who learned in the trenches, learned from work experience, and she was very excellent at her job. When she retired, it probably took her 3 months to train the person that took her place. So I don't know what happened because I know that person has moved on too. So I do think that is to know all those ins and outs, and those people just learn it on the job. So I don't know if you guys have any ideas about educating billing people, but that was really a great asset for us at North Bend Medical. Did that answer your question, Lon?
Yes, it did. Thank you very much.
Okay, we'll go back to Ryan.
Thank you, Kim. I appreciate it. I kind of want to just touch on two things real quick. You mentioned education of clinic staff. I will say from my experience, that's absolutely true. The interactions that I get as a workers' comp manager from clinics really depends on the staff that's staffed there and their knowledge of how the workers' compensation system works. I can tell you, just by those interactions, what clinics are going to be successful in workers' comp and which ones aren't. So I just wanted to echo that point that Audrey brought up, that staff is really critical in this. And then I also wanted to kind of go back to the MCO and nurse practitioner treatment guidelines of the 180 days. I really like that MCO model, and essentially kind of, correct me if I'm wrong, Audrey, from my understanding, the nurse practitioner can treat up to 180 days. Once they reach that point, the MCO allows them to continue treating with the oversight of an MD or DO. And that's who I'm assuming you were mentioning, I believe Lisa or somebody along those lines, named wise. But I believe that's what that person was doing. Could you see that model continuing outside of the MCO model, if that makes sense? So maybe having nurse practitioners doing 180 days and allowing them to continue as long as they are partnered with an MD or DO. Do you think that would be successful outside of an MCO, basically, if that makes sense? Thank you.
I think it would. I think it would.
Yeah.
And I had great people to work with, and it worked really well.
Awesome. Thank you for that. I appreciate it.
Co-chair, we have a question in the room with Administrator West.
Go ahead, thank you.
Good morning. Thank you. Thank you, Audrey. So I'm Matt West. I'm the administrator here at the Workers' Comp Division. One of our goals is, you hit on the education outreach. We are constantly looking at ways to, educate all stakeholders, but specifically, nurse practitioners, physician associates, doctors, on, I guess, trying to dispel maybe some of the myths in workers' comp and so any advice for us, and we could always connect afterwards too, on like where are those opportunities that we're missing? You mentioned, some conferences and things, and there were rarely workers' compensation topics on the agenda. So, if you have some off the top of your head, or we can reach out afterwards and connect, but I'm really curious to hear, when and where are these conferences? What are the organizations that we seem to be missing?
Oregon State Board of Nursing has a fall conference every year, or they have had in the past. So that would be one place in Oregon specifically to reach nurse practitioners. I used to attend some PA conferences that they would have on a yearly basis. I don't know if they have a state association like the Oregon State Board of Nursing, the Oregon Nurses Association, nurse practitioner group has, but that would be definitely the Oregon Nurse Practitioner Group would be, ONA's Nurse Practitioner Group would be where to connect with NPs in Oregon for educational stuff.
Thank you.
And Matt, I can add to that too. I used to attend Lane County Association of Nurse Practitioners. They would have I think it was an annual conference or
In the
every
spring.
2 years. And it was really good. It was really good, targeted for nurse practitioners. That would be a great place to add, a topic on treating injured workers or workers' comp. And then the GOSH conference. I mean, the GOSH conference is great. And for a lot of the safety and health, but that would be a great opportunity to add some sort of, workers' comp 101 or workers' comp for billing people or whatever, because there's such a variety at that conference.
Which I'm not familiar with that one.
That's the governor's occupational safety and health conference. Is every 2 years. It's up
Oh.
at the convention center. And it's mostly, it's very industry heavy, but there's like usually a medical health track. Um, and that would be, a great place to add something.
Yep.
Yeah, thanks, Kim. We participate each year in GOSH, but I think maybe the healthcare track might be something we're not participating in currently. So we'll work with OSHA on that. Thanks for the suggestions.
Co-chair, the other co-chair has a question.
I was just going to add a comment that Matt, I might know somebody who's familiar with O&A who might be able to help with
Emily,
Thank you.
co-chair, Cronin, I have a question. Is there local chapters, like Kim just mentioned, Lane County nurse practitioners? Or is it just statewide, or how does that work? Because I'm not
So
sure.
our NPO, or professional association, which is it's not a subsidiary, they're an affiliate, right? They kind of operate within O&A on their own, if you will. They're state. But that doesn't mean that they don't have significant relationships with some of the regional chapters, if you will, of things that are going on, maybe specific to OCMED or inpatient. So we have also like union bargaining units, right, that might be appropriate to connect with whatever there's going on in their region to be able to do some additional education. So, but NPO is state.
Okay. Gotcha. This is so much great information. Thank you.
It looks like I see Ann Klein's hand is up.
Yes, thank you, Kim. I'm having all sorts of technical difficulties, including finding my hand. So I just wanted to, and getting unmuted, all of that. I just wanted to circle back really quickly on the nurse practitioner extension program that that Majoris partnered with Audrey on and a number of other nurse practitioners throughout the state, just to provide the other side of how that partnership and collaboration works currently. What we identify is there are certain practitioners who really understand workers' compensation or have a desire to want to lean into that space. And we have started, especially in those areas that are more rural and have challenges, partnering with those advanced practitioners to create a collaborative partnership of extending beyond 180 days where it appears appropriate that they feel comfortable and confident in continuing on beyond that. And right now, as part of the process, because we do have also the regulatory and statutory framework, what we do is with each case that comes up to that 180 days that's treating with one of the nurse practitioners that is designated as this extender potential or extender credentialed, that will then issue on that claim extended authorization of attending physician. And as the managed care organization, we have that ability to do that within our MCO plan. And then we make sure that that's documented so that WCD also has on their side that that authorization has been officially extended for that case with that practitioner. We also have seen just how productive and helpful this type of partnership and collaboration can be, and are actually right towards the very end of some development of a credentialing program that we're hoping to offer statewide to any advanced practitioners, nurse practitioners, or physician associates that are interested in leaning into that. Next step will be, after we've designed the program, we'll have to update our MCO plan and get approval to do that more blanket credentialing option and program. And part of that program is specifically focused on outlining an educational training program to offer and walk through some of those functions of work comp that sometimes can be confusing. And we really are looking at that credentialing component is tied to an educational and supportive component when we're setting that up. So just a little bit more background and context on that particular MCO process.
Thank you, Anne. That's great information. Thanks for sharing that. Do we have any other hands up?
We don't see anything, Coach Ann.
Okay, thank you. All right, well, I think then, Audrey, thank you so much for joining us today and sharing your background and your expertise and 17 years in workers' comp. That's kudos to you. That's a great achievement.
I enjoyed it.
Well, thank you so much for all that you have done.
Thank you. Welcome.
Yeah. Let's see. So the next thing on the agenda is really just like an open forum for any public or stakeholder comments. So do we have anything else?
I do not have anything, so this is gonna be a short meeting today, so enjoy your Friday.
I would say short but fruitful.
Yeah.
Terry, do we have a meeting coming up again in 2 weeks?
Yes, on August 8th, and we will have providers from Eastern Oregon, and I might say this name wrong, St. Alphonse, little St. From Ontario. I'm gonna
Saying
say the
Augusta.
name wrong.
I think.
What'd you say?
Augusto.
Maybe that's it. Yeah.
Yeah.
I apologize. I don't have it in front of me right now, but we do have interim medical director and operations manager coming from Ontario at the next meeting. So
Great. And in the meantime, if any of you have any additional thoughts or feedback that you've thought of, as you reflect, through some of these meetings, please reach out to Terry or Emily or me or all three of us, any one of us, to provide that input. That'd be very helpful for us to gain, just this perspective at this time.
thank you, everyone.
Hey, thanks everyone. Have a great rest of your day.
Thank you.
Bye-bye.
Thanks, Audrey.
You're welcome.
Thank you.